The main challenge we face at the moment is really the sheer numbers of patients coming through the Royal with cancer diagnoses. This results from a number of different factors. We're much better at raising awareness of cancer in the community. We're much better at finding those cancers, and the population is living longer. That combination of factors means that we will see and continue to see an increasing numbers of patients with cancer coming through the Royal. A further factor is we now have access to far more treatments than we used to have before. These treatments are increasingly successful, so patients are living with cancer longer, and in many cases they're actually beating the cancer and moving into the survivorship part of their journey. The combination of all of these factors, the increasing number of patients, are what really give us the challenge ahead. At present levels, we make approximately 1,500 new diagnoses of cancer across all the sites that we deal with. But at any time, we would have a further 9,000 patients going through the assessment process, the treatment process, and being involved in follow-up and indeed the survivorship agenda. We have seen, just for example, between 2002 and 2012, we saw a 70% increase in the number of outpatient oncology appointments that we delivered here at the Royal in conjunction with our partners from Western Park Hospital in Sheffield. Those are the levels of increase that we are seeing and continue to see. And when you bear in mind that Cancer Research UK only recently have revised their projections in relation to cancer to the fact that they believe unless we undergo lifestyle changes, it'll be 1 in 2 of the population having a diagnosis of cancer within their lifetime. But we're actually putting in this new facility at exactly the right time. We need to be ready to be able to deal with the increasing number of patients that we're going to see, and we need to be able to expand our services, and to do that we need the right infrastructure. We will have the right infrastructure with this new unit. Well, the quality of care that we deliver at the moment is excellent, but we are severely restricted by the accommodation that we currently have. Much of the accommodation is not purpose designed and has restrictions in terms of what we can deliver and how we might deliver that. The bringing together of all of those services into a purpose-built unit allows us to bring the professionals together, create an efficient patient flow, and provide a much more holistic patient experience than we've been able to do before. And a key part of that is providing support to the patients during their journey through cancer treatment with us, and the ability to provide a dedicated support centre to them is one of the real key benefits to what we're trying to do with this new unit. We hope that the new unit takes the atmosphere from our present limited facility, which is really well high regarded by the patients for the experience that they get particularly whilst they're having treatment and chemotherapy in particular. But in addition, there'll be many more benefits. There'll be the new Macmillan Support Centre, which will be purpose-built and designed to provide support throughout the cancer pathway, from initial diagnosis through assessment, treatment, and then on into survivorship. They'll be able to access a range of different professionals, and we hope to support them with additional voluntary sector contributions, and also to enable us to provide our partner organisations with a more appropriate setting in which to come on site and to deliver their part of the treatment process. I think we at the Royal see the partnership with Macmillan as being a really positive new partnership. Macmillan Cancer Support is probably the UK's leading cancer charity. I think virtually everyone has heard of Macmillan, knows what Macmillan do, and we also know what they do extremely well. And what they've brought to this project so far is a level of expertise, particularly in relation to the design of cancer accommodation and facilities that we otherwise wouldn't have had. There'll be many benefits to the staff, but I think the principal one is bringing key professionals from different parts of the cancer pathway together into the same place, allowing them to work more effectively and efficiently as a team, enable us to change our clinical pathways to benefit the patients that we treat. I think they will also very much appreciate working in a purpose-built infrastructure that they actually have been central to the design of, and we've been very, very fortunate that our staff have been able to contribute to the design of the new building, and therefore we hope that it will be as efficient and as effective as it possibly could be. We often talk about highlights in our lives, and I think from a professional point of view, the day this unit accepts its first patient will be probably will certainly be the greatest moment in my career so far.